Hi, I'm Dr. Jason Wagner, Sarasota Vascular Specialist, and thanks for joining me for another Whiteboard Wednesday. Today we're going to talk about vein ablations. A lot of my patients will say, hey, okay, I understand I need to have a vein ablation done, but what's a vein ablation? So a vein ablation is when we're shutting down a bad acting vein. The first and most important thing we need to do is make sure that all of the other veins are doing their job and they're good veins, specifically making sure that the deep veins are open. That's one thing that will separate a board-certified vascular surgeon and a certified vein center like ours. We pay attention to the deep veins. So before we even get talked to about having a procedure done, we want to make sure that the deep veins are open, that they're doing their job, and that whatever vein we're talking to about shutting down, usually it's a superficial vein, is the bad acting vein, and that all the other veins are there to keep doing the normal good work, and that we just get rid of the one bad actor. The idea of shutting down a bad acting vein is that this vein has bad valves that are letting blood settle the wrong way with gravity. The idea being getting rid of the bad acting vein, leaving all the normal veins to do their job, the leg swelling that's being caused by the bad vein goes away once it's gone. We do what's called a minimally invasive or percutaneous, we use a needle to get into the vein itself, ablation. The two different ways we can do it is either with a heat-based catheter, so a radiofrequency catheter or a laser catheter, or with a foam ablation where we actually inject a solution that causes the vein to shut down, to kind of spasm down and stick to itself and shut down. In summary, vein ablations are when we shut down a bad acting vein, making sure that the remainder of the veins stay open and keep doing their job. You want this to be done by a board-certified vascular surgeon in a certified or accredited vein center. Sarasota Vascular Specialist only has vascular surgeons that are board-certified, and we have an accredited vein center. We're the first accredited vein center in our area. If you have any questions, please feel free to reach out, leave a comment below, visit us at sarasotavascular.com. Again, I'm Dr. Jason Wagner with Sarasota Vascular Specialist, and this is another Whiteboard Wednesday.
Thank you.